Good morning, and thank you for being here. My name is David Neufeld, and I'm the National President of the Union of Safety and Justice Employees, or USJE. USJE represents nearly 20,000 members across 18 federal departments and agencies, all of which uphold public safety and access to justice in Canada. Today, USJE is releasing a new research report examining the experiences of correctional program officers, the professionals responsible for delivering rehabilitative programs in Canada's federal correctional system, in prisons, and in the community. These employees are essential to public safety. Their work helps individuals in custody or under community supervision develop the skills they require to safely and successfully reintegrate into communities across Canada. Fundamentally, correctional program officers are mandated to facilitate positive rehabilitative experiences for individuals serving federal sentences. Despite the critical nature of this work, very few Canadians even know that these professionals exist. Correctional program officers, or CPOs, are often described as the ghosts of rehabilitation. They work directly with people in custody and on parole to deliver programs focused on behavioral change, accountability, and reintegration. But until now, their experiences, wellness, and workplace realities have rarely been studied or discussed publicly. USJE commissioned this independent research to better understand the conditions that these professionals face and how these conditions affect both the health of staff and the perspectives of correctional program officers regarding the effectiveness of rehabilitation programming. The findings are concerning. The report shows many CPOs entered this profession because they wanted to make a positive difference and contribute to public safety. But once on the job, they face significant structural and organizational changes. Among the key issues identified are overwhelming workloads that make meaningful program delivery difficult or seemingly impossible, pressure from management to prioritize program completion, for example, heavy emphasis on program completion and quantity of offenders served over the quality of the programs delivered, extensive reporting requirements and administrative burdens, organizational stressors that exceed operational ones, in many cases including overwhelming workloads, legislated timelines, and profoundly inadequate workspaces. In addition, limited recognition within the correctional service for the role that CPOs play, not to mention the lack of access to trauma-informed health supports, despite their sustained interaction with people who are criminalized. These pressures affect both the health of staff and the quality of rehabilitation programming. Many correctional program officers in this study described the work as emotionally demanding. Some spoke about experiencing burnout, sleep disruption, anxiety, depression, or other symptoms consistent with trauma exposure. Others described the work as haunting, meaning the emotional fallout of the job followed them home. This is not sustainable for our employees and ultimately affects the system's ability to deliver effective rehabilitation. Rehabilitation is not a secondary function of correctional services. It is a core pillar of public safety, integral to the mandate of the Correctional Service of Canada. When rehabilitative programs are effective, people are better prepared to reintegrate safely and successfully into communities. But rehabilitation only works when the professionals delivering those programs have the resources, training, and support necessary to do their jobs properly, as they hope to. Right now, the report shows many correctional program officers feel unseen, unappreciated, undervalued, overstretched, and unsupported. USJE believes the findings in this report should serve as a call to action. We are calling on the federal government to recognize the critical role that correctional program officers play in rehabilitation and public safety, ensure staffing levels and workloads allow programs to be delivered effectively with an emphasis on quality, not quantity, equip correctional program officers to develop programs in response to the needs of the offenders in the classroom, improve training, mentorship, and career development opportunities, and strengthen mental health supports for these crucial federal public safety personnel. Now, in recent weeks, CSC has announced it will be modernizing its correctional programs under the Comprehensive Expenditure Review in order to arguably improve efficiencies and reduce administrative burdens. While specific staffing implications are not yet known and will depend on the results of the internal review, USJE is urging the federal government to refrain from proceeding with implementing so-called efficiencies until it has had an opportunity to review Dr. Ricciardelli's report and fully apprehend the findings. Correctional program officers have a very unique vantage point when it comes to the difficult work of rehabilitation with federally incarcerated offenders, and their perspectives need to be heard. If the Government of Canada is truly committed to the rehabilitation of individuals serving federal sentences, we must support the people responsible for delivering rehabilitative programs. This is why we are calling on the Correctional Service of Canada to halt its plans to reduce the number of correctional program officers and related supports. It is now my pleasure to introduce Patrick Ménard, Regional Vice President for USJE, to make some remarks.
Merci, Monsieur le Président. Alors, bonjour. Merci d'être ici. Mon nom est Patrick Ménard. Je suis le vice-président régional de la région du Québec pour le SEJ. Comme l'a mentionné Monsieur le Président David Neufeld, le SEJ publie aujourd'hui un rapport de recherche novateur qui examine les expériences des agents et agentes de programmes correctionnels. Ces professionnels chargés de mettre en œuvre les programmes de réinsertion sociale au sein du système correctionnel fédéral canadien, tant dans les établissements pénitentiaires qu'au sein de la communauté. Ces employés sont essentiels à la sécurité publique. Leur travail aide les personnes incarcérées ou sous surveillance communautaire à acquérir les compétences nécessaires pour se réinsérer en toute sécurité avec succès dans les communautés partout au Canada. Fondamentalement, l'objectif ultime est de diminuer le risque de récidive des délinquants. Malgré le caractère essentiel de ce travail, très peu de Canadiens et Canadiennes savent même que ces professionnels existent. Le SEJ a demandé cette étude afin de mieux comprendre les conditions auxquelles ces professionnels sont confrontés, à la fois la santé du personnel et les perceptions et l'efficacité des programmes de réinsertion. Les conclusions sont préoccupantes. Le rapport montre que de nombreux agents de programme ont choisi cette profession parce qu'ils ou elles voulaient faire une différence positive et contribuer à la sécurité publique au Canada. Malheureusement, une fois en poste, les agents de programme sont confrontés à d'importants défis structurels et organisationnels. Les pressions ont des répercussions tant sur la santé du personnel que sur la qualité des programmes de réinsertion. Les recherches que le SEJ partage aujourd'hui soulignent que nous devons faire mieux pour soutenir les agents et agentes de programmes correctionnels qui accomplissent le travail difficile de réinsertion sociale des délinquants fédéraux. Nous ne pouvons absolument pas tenir leur importante contribution pour acquis. Le SEJ espère que les recommandations présentées dans le rapport seront prises au sérieux, mises en œuvre rapidement et qu'elles inciteront le service correctionnel à marquer une pause avant de procéder à des coupes budgétaires qui pourraient compromettre davantage la capacité des agents et agents de programmes correctionnels à offrir des programmes essentiels visant, comme je l'ai dit, à favoriser la réinsertion sociale sûre et réussie des délinquants sous responsabilité fédérale. Parmi les principaux enjeux identifiés, on retient que les agents de programmes correctionnels décrivent une charge de travail importante, voire écrasante, qui empêche la mise en œuvre efficace des programmes. Le service correctionnel privilégie une approche misée sur la quantité plutôt que la qualité, expliquant que la priorité semble être accordée à l'achèvement des programmes et non à un apprentissage approfondi des détenus ou des libérés conditionnels. Des exigences administratives considérables sont également relevées dans le rapport, des facteurs de stress liés à l'organisation qui, dans de nombreux cas, l'emportent sur les facteurs opérationnels, des charges de travail importantes, des délais extrêmement serrés de production en raison des exigences de la Commission des libérations conditionnelles du Canada. Et le tout doit s'effectuer bien souvent dans des locaux souvent inappropriés afin d'exécuter les tâches. Une reconnaissance insuffisante de leur rôle et un manque de soutien en matière de santé mentale est noté. Il faut noter leur forte exposition aux personnes criminalisées, aux antécédents des personnes qu'ils doivent côtoyer au quotidien, ainsi que les conséquences et traumatismes vécus par les victimes. Merci à vous. Je redonne la parole à M. Neufeld.
Merci, Patrick. And now to walk through the research itself and the detailed findings, I'm pleased to introduce the lead researcher behind the study. Dr. Rosemary Ricciardelli is a leading expert on public safety, specifically correctional work, occupational stress, and safety in Canada.
Thank you, David. Thank you also for listening. It has been a privilege to conduct this research alongside my team of colleagues and with the participation of federal correctional program officers in Canada. The study involved 102 CPOs, correctional program officers, working in the Federal Correctional Service, both in the community and in institutions, and the data was gathered through extremely long, in-depth interviews conducted between June and November of 2023. The goal was very simple: to better understand the realities of this profession, because people just don't know who delivers programs in the prisons, and identify ways to strengthen both staff well-being and program effectiveness. Please recall, this report is against the backdrop of much literature documenting and evaluating correctional programs which are known to be falling short slightly in meeting rehabilitative needs. CPOs, they are motivated, hardworking, and committed. Participants in this study chose the profession to help people change their lives, to recover, to contribute to public safety. Many only learned of the CPO job through previous experience in parole or working as officers. They care deeply about the individuals they provide programming to, be it Indigenous programs, sex offender programs, or any program, and about the broader goals of rehabilitation. My team and I revealed a gap between the aspirational goals of correctional services and the operational realities staff face. Program officers, they are core to the mandate of CSC, assisting offenders, supporting offenders as they become citizens, law-abiding citizens in Canada. It is about rehabilitation. It is the crux of correctional services. An important finding was that organizational stressors often outweighed the operational ones. Organizational stressors are things like heavy reporting timelines and requirements, pressures to increase the speed of program delivery, and administrative processes and management expectations. Many participants felt that the system prioritized completion statistics over meaningful learning and behavioral change. This tension made it really hard for facilitators, these CPOs, to deliver programming in the way they knew was most effective. They were delivering programming independent of literacy, English language, cognitive ability, etc. Another key insight in this study is the complexity of the populations in which the CPOs work. They deliver programming to diverse groups. Many Indigenous correctional program officers are Indigenous themselves, with the same histories as the very people to which they deliver the programs to. Individuals convicted of serious sexual offenses are being delivered programs inside which are extremely demanding on those CPOs. Those serving time in federal penitentiaries and under supervision in the community, per the terms set out by the Parole Board of Canada, all must receive their programming. There's pressure for completion, but quality is even more important than quantity. Each of these contexts requires specialized knowledge, sophisticated emotional intelligence, and adaptability. For example, Indigenous CPO, they carry additional burdens. They are to deliver programs with elders. 50%. It is an unfeasible target to meet, and without that ICPO too is left without the supports they require. We also heard consistently about the psychological and emotional impacts of the work. Participants spoke of hypervigilance developed through their working environments, exposure to abhorrent and difficult material, often traumatic. They are listening and learning not just about an individual's crimes, they are working with the person. They're learning about their fantasies, their desires, their thoughts. They are trying to help them do better and make different choices. They have emotional exhaustion and there is burnout. And while many staff adopt coping strategies like exercise, family support, mindfulness, they also emphasize the need to know what's available to them, to have it accessible, and to have it specialized. It's a complicated space. The report does not identify challenges only. We put forth considerations, practical considerations for improving working conditions and strengthening program delivery. These include training and mentorship, revising performance metrics so that quality matters alongside quantity, strengthening staffing levels and workplace infrastructure, enhancing wellness, and providing supports that recognize the material in which they are dealing and the individuals in which they are working, and incorporating the expertise of experienced correctional program officers into program design. They know what their participants need, their program participants, they can help. The goal is not simply to improve working conditions, it's to ensure that rehabilitative programming can achieve its intended impact. If they were able to do their job as intended, these programs would have their impact. They play a crucial role in Canada's correctional system. They build relationships in these complex environments. They are constantly working for the betterment of public safety. Supporting them is not a workplace issue. It is an investment in effective rehabilitation and safer communities. This is a uniting, not a dividing issue. We all want people who will return to society after serving a third or two-thirds of their sentence to undergo programming that is effective, and we want the people delivering it to have the capacity to do their best. So we need to do something here. And that is why we are calling on the government to please reconsider the cuts. Thank you.
We don't have any questions at the moment. Nous n'avons pas de questions pour le moment. So this will conclude the press conference. C'est ce qui met fin à cette conférence de presse. Merci.
Thank you.
So.